Would you like to know some tips and tricks to get the most out of your doctor visit? I'm Dr. Kane Treble and this is Long Consult. Tip 1. Be on time, but expect to wait. This one sounds a little hypocritical because a lot of GPs do run late. But there's a reason why being on time is important. Check out the bulk billing episode from the links below for more details, but many GPs are forced to practice short consultations to ensure the financial viability of the whole clinic. And while many consults might start late, meaning you're waiting in the waiting room despite your appointment time passing, this is normally because, despite the pressures to practice fast medicine, we still practice good medicine. If a patient has a particularly complex issue or needs that need that little extra time, we still take it, or we try and set up a safety net until more time can be dedicated to that issue. This means that the scheduled times may blow out, and if there's a few of these in short succession, those times can blow out pretty quickly. Rest assured though that while your GP is doing everything they can to get to your appointment as scheduled, sometimes that extra time means someone gets the help that they need, just like you will when it's your turn in the seat. What is frustrating for everyone, however, is if the reason people are forced to wait is because people are simply running late. Now, there might be very valid reasons for this, but try your best to be on time, or even better, 5-10 minutes early. Tip number 2, make a list and write it down. We've all walked into another room of the house and asked ourselves why we're there. Sometimes this can happen in your GP clinic as well. Make sure you get all of your concerns addressed by putting together a list of your priorities of the consult. Give this to your GP at the beginning of the consult, and this lets your GP know quickly what's happening in your life and helps prioritise what issues need to be dealt with today versus what might have to wait for the next consultation. I'll warn you now, if there is something that's worrying them, they might jump ahead and prioritise that over the things that you might feel are more important to you. One way to communicate this is to put a star or some kind of mark next to the things that are most important to you and let your GP know when they're reading your list. Tip number 3, if there's more than 2 items on your list, ask for a long consult. Moving along from the last point, I've seen lists with 30 different problems listed on them. Suffice to say, we didn't get through all of them in a single session. My rule of thumb is if there's more than 2 issues on your list, ask for a long consult, much like this video's namesake, which means you get a longer appointment. Be aware that with a lot of items, you might still need a few appointments to get through them all. Tip 4, ask if you have any outstanding results. Your GP likely gets dozens, if not hundreds, of test results each workday. And while every result is checked and followed up, many normal or reassuring results are left until the next appointment when you book to be discussed. If a long time passes between appointments or other issues arise which distract, these results can sometimes get left in the background. Your GP will still have a record and most results will be kept when and if they've been discussed previously. So take a moment to make sure that you're aware of all the results you haven't been directly informed about, because they might be relevant to your current health. Tip number 5, ask if you're due for any screening tests. Australia is incredibly lucky for the investment in preventative health and screening programs provided under Medicare. With most medical conditions, the earlier we intervene or preferably prevent from occurring, the better the overall health outcome. Ask your GP if there's any screening tests or examinations that could be appropriate for you and what you should do to make them happen. Tip number 6, feel free to take notes and ask follow-up questions. Large medical words, time pressures, and complex conditions can make it confusing even for highly intelligent people to remember everything that was discussed during a consult. I myself have forgotten details of my own appointments when I get home and my wife asks how it went. Feel free to take notes during the consultations. Smartphones often have note-taking features and dedicated note-taking apps exist, but I've always had a soft spot for good old pen and paper. Remember that many places still have laws against audio or video recording without explicit consent, so discuss this with your GP before attempting to record a consultation on your phone. The 2 big flags I'll place on this tip are, number 1, most GPs won't allow audio or video recordings of consults, and this is often clinic policy, so don't be offended if they kindly ask you not to. And number 2, don't let the note-taking actually get in the way of having the consultation. If you're spending more time taking notes than discussing your issues, it might be better to write things down after the consult when you're in the waiting room. Number 7, bring an up-to-date list of your medications, or better yet, the packets themselves. This is one you don't have to do every GP visit, but I'd say a few times a year, it'll definitely be worthwhile. Between your GP and any other specialists you might see, medication tweaks can get lost between letters. The easiest way to make sure your GP knows what you're taking is to actually show them. The boxes not only have the name and generic names for your medication, but the exact dose, dosing regime, and the prescriber details printed on them, so any changes can be quickly updated. Bring in any over-the-counter medications, supplements, or additives you might be using as well. You'd be surprised how many potentially dangerous medication interactions have been discovered by doing this. Number 8, stick to one GP, or at least one clinic. It's important you find a GP who you click with, can communicate openly and honestly with, and that you trust with your healthcare. This can take some shopping around, but it's preferable to stick with one GP to ensure good continuity of care, and particularly if you have complex care needs. If this isn't possible or your preference, sticking to at least one clinic means that records and results are easily accessible and plans can be more easily continued or adjusted rather than trying to coordinate plans from multiple clinics. As far as technology has come, many GP clinics are still forced to use fax machines as the primary method of communication. Accessing and reviewing complex patient records can become tricky, if not downright difficult, and can increase the risk of errors or oversights. Tip number 9, do a 20-second summary at the end. Phew, made it this far? Great! But just like how we've talked about a lot today, consultations can be information dense, with suspicions, results, plans all jumbled together. You should do a 20-second summary at the end of the consult. Not only does it let your GP know what you understood and what you discussed, but also it's a great way to check if there's any things that you may have forgotten or need reinforcement. Tip number 10, ask if another appointment should be made to follow up, and if so, when. Often things will need to happen after the consult, so see what these things are, when they should be performed, as well as how the results should be followed up. Often this just means making another appointment with your GP, but occasionally additional things are required, and best to know them now rather than when you leave the clinic. Finally, your GP might completely disagree with this list, or have a different approach to the way they practice. So why not talk about their top 10 things to make the most of your consults? Open and honest discussion between you and your GP will build a therapeutic relationship aimed at keeping you in the best health possible. So thanks for joining me today. This channel will be releasing regular health tips and tricks, so if you like this video, like and subscribe, click the bell to be notified of our next upload, and let me know your favourite tips and tricks when you see your GP in the comments below. I'm Dr. Kane Treble, and this has been another long consult. Catch you next time.